Hey everyone, it's Phil Hall of West Fair Communications, and thank you for joining us on today's episode of West Fair Video Conversations. Today we're going to be talking about telehealth, and there's an exciting new program over at Sacred Heart University in Fairfield. They're going to be offering a telehealth certificate program, and our guest is here to tell us all about it. She is the lovely Dr. Faye, Dr. Donna Faye McHaney of the university. Dr. McHaney, thank you so much for being a guest on today's program.
You're welcome.
So tell us a little bit about the online certificate program that you're going to be offering regarding telehealth.
So this program has been under development for about a year and a half now. And so we've been really working on developing the program so that it is for our advanced practice nurses, particularly nurse practitioners. And we've worked toward making sure that we have the content we need and the expertise we need to teach the courses as well. So the program itself is geared for advanced practice nurses who are nurse practitioners so that they can gain some skills and knowledge on telehealth that can be used in their practice or in the practice that they happen to be working in. So we think it's going to be an exciting program.
Well, certainly a very timely program. I think we've heard more about telehealth in the past 7 or 8 months than we've probably heard in the past 7 or 8 years.
Yeah, telehealth actually has been around for 30, 40 years actually being used. And it hasn't been used that much. It can be anything from telephone visits to what we see where you do a full head-to-toe assessment with telehealth equipment. So what we seen in the past was a lot of telephone type communication and those kind of things with patients via telehealth. But today we're seeing more with like Zoom meetings and, other platforms that are attached to EMR type systems, electronic medical record systems. And there are also some clinics that actually have telehealth equipment where they can do head-to-toe assessments on patients and listen to their heart, listen to their lungs, view their ears and eyes and those kind of things, and do an actual visit. So it's a wide spectrum of what telehealth might be. So, and certainly COVID, was a tipping point for some of that.
Oh, definitely. Prior to COVID, what was the university's approach to telehealth?
When I come here, when I first come to the university, I approached the dean and the associate dean with the idea of starting telehealth here. So it's been in communication, I've been in communication with them over time. And then we developed the program, got approval for it, and now we're getting ready to launch it in spring. So we've had a lot of conversation about it and the various modalities of telehealth and how we can educate our students on telehealth, because that's a big component of what needs to happen in the industry. So we began to integrate telehealth into our curriculum, and we're continuing to do that as we migrate over the next academic year.
What goes into your telehealth certificate program? How many weeks and how many courses do the students have to go through?
So there's 4 8-week courses that span across 2 semesters, and that is it. That's the entire program. So they would take 4 consecutive 8-week courses to complete the entire certificate.
I assume, of course, these would have to be hand-on courses. It's one thing to learn about telehealth in theory. You actually have to use the communications and computer devices in order to have the proper communication between practitioner and patient.
That is correct. Our first 3 courses in the certificate program are online, and we'll be teaching students about what telehealth really is from beginning to what it could be for them in their clinic. We'll teach them about reimbursement, about how to set up equipment, what they might need to look at depending on the type of clinic they have, or what their goal is for how they want to use it for their patients. And then the very last 8 weeks, the last course they take, they'll actually do clinical hours out in the field with some partners who will be letting them experience the telehealth.
Wow. I've been covering the technology field for a number of years, and one of the more amusing aspects of that work is seeing how different technology standards sort of elbow each other until one becomes the dominant in a particular field. Is that the same in telehealth? Are there competing standards for the technologies being used?
There are competing companies and there are competing standards, and like I said, it depends on specifically what that particular clinic wants to do. They may decide they just want to do Zoom meetings and do consultation with their patients, or they may want to do the full scan where they have physicians located in remote areas from the clinic, or different types of setups for their telehealth where they would actually want to be able to do a full assessment on those patients. Depending on, it really just kind of depends on what their clinic goal is, and what their outreach for their patients might be as well.
When are you going to start offering this program?
The program will start in spring of next year, which will start January the 4th. So we're already taking admissions and, doing recruitment for the program as we speak.
Are you getting a lot of positive feedback from students who would like to pursue this program?
We've gotten a lot of feedback. I've interviewed a lot of individuals, calling me and just asking me about the program. So we're getting a lot of feedback from uh, from people in the industry. It's very popular. I think just from what I can tell, from what I have been doing in just in the over the last couple of weeks, actually.
Wow. My ignorance might be showing with this question, but what is the difference between telehealth and telemedicine?
Well, telemedicine would be the use of telehealth equipment to care for your patient, basically. Telehealth would encompass the equipment. It's going to encompass, like I said, the modality, how you set it up, what you're using. So it encompasses everything, where telemedicine might be just the use of telehealth equipment.
Wow. Well, this has been a very trying year for healthcare professionals. Are you seeing more young people interested in going into careers in nursing?
Well, I think in my programs, and I'm the director over the nurse practitioner online program at Sacred Heart and the Postmaster's DNP program. In my particular programs, we have seen an increase in individuals wanting to come to, change their career from just regular nurses to nurse practitioners so that they can help, provide that care that's needed in the industry.
Are your classes growing substantially in terms of enrollment over these, or particularly since the pandemic? Are you getting more increase at the school for people who want to study nursing?
We do. We have been getting some more inquiries. I think that overall, there are a lot of people who come to nursing anyway because they choose that as a career. But I think because of COVID, there are a lot of individuals who want to contribute. So they're looking at the nursing programs as a whole, not just FNP programs, but all the way across the spectrum of the different kinds of nursing programs.
What is the state of telehealth within Connecticut's healthcare system, particularly within the Fairfield County area where Sacred Heart University is based?
I think, I know there are other universities looking to train their students coming out of their curriculum. I've had quite a few inquiries since we've started this from other universities about how they can incorporate telehealth into their program. And we've been very successful this semester with that, with our students. So I think the climate's changing in the Fairfield, Connecticut area in regards to a lot of clinics, and a lot of hospitals are really looking at telehealth now. And it's a great way to improve access to patients, and to get that care, out there as needed.
Mhm. I know when the pandemic began and doctors were forced to postpone a lot of the non-emergency appointments that they had. My mother, who's in her 80s, was asked by one of her doctors if she would be interested in a telehealth consultation.
Mhm,
And she
mhm.
called me and she says, "What's telehealth?" She wasn't
Right,
aware of that. I tried to explain it to her, and she was completely baffled by it.
right, right.
Did you find that with a lot of people at the time of the pandemic began, and they were just learning about telehealth for the first time?
Yeah, I think so. I think particularly patients because they really just didn't know what it was. And so I think people are more aware today
Mhm.
because of that. And there are also healthcare providers that were like, oh gosh, what are we going to do? How are we going to handle this? And they're new to even using Zoom or, some of these other types of platforms for telehealth. So I think it's been a learning experience for everybody, in telehealth. So, and that's why our certificate is such a good thing now because we can train people to have that knowledge and skills to do what they need to incorporate it into their practice.
Do you foresee the possibility that this certificate program could one day evolve into a degree program?
Possibly, it may depend on, how detailed you wanted to get the program itself, and certainly it would need some expansion to do that. Um, I could see where there could be individuals, particularly nursing informatics individuals, who might want to expand their knowledge and be a part of including implementing telehealth, technology into practices.
Excellent. So, for people who would like to get in touch with you regarding this program, what's the best way for them to reach out?
They can reach out to the school and inquire about the program itself, and they will put them directly in touch with me from that point on.
And just to clarify, do you need to be enrolled in the nursing program at Sacred Heart for this, or could you have already completed your undergraduate degree and you'd just like to get the certificate independent of the nursing studies?
You do not have to be enrolled at Sacred Heart, but you do need to have a master's degree in advanced practice, be an what we call an advanced practice nurse, and they would all have master's degrees.
All right.
Or if
Mhm.
they have a DNP or doctoral degree as well, and they're a nurse practitioner, they can also come to the program.
Well, that certainly sounds like something that's really quite innovative. But Dr. McHaney, if we were to have this conversation 1 year from today, where do you see both your program as well as the overall state of telehealth?
Well, I think telehealth is here to stay. I think certainly we've had a shift in healthcare delivery because of COVID, and I think that we're going to see more and more advances to using telehealth technology in clinics because certainly a lot of companies or practices now are using like Zoom and stuff. And I think you're going to see a little bit of a shift. Even some of the software companies are beginning to include packages for telehealth with their electronic medical records. So I think, we're going to see some movement forward, and I think it'll be easier as individuals, gain the experience and understand it better and the different things that they can do, for their patients. And it's certainly going to help access to care across the country. And so I think we'll see some big movement in telehealth over the next year.
Well, we are obviously speaking about Sacred Heart University and as well as our
Mhm.
part of Connecticut. But from your understanding, what is telehealth like overseas? Are countries in Europe and Asia and the Middle East at the same level where we are, or are they a little bit ahead or a little bit behind in telehealth?
I really don't know if I can answer that question, but I think that telehealth is used overseas, particularly in different practices. I know individuals who are nurse practitioners that actually do telehealth, and some of their work expands abroad. Um, Even my practice as a nurse practitioner expands abroad some. So, I think it's there, and I think that we'll see some movement there as well in the future.
Well, if this is an online program, you could probably get yourself a whole slew of students
Sure,
around the world who'd be interested in having this as
sure.
part of their
We
education.
already have students from other countries in our program, particularly Ireland. So I certainly could see that as well.
Yeah, thumbs up for Ireland. Excellent.
Right.
Well, Dr. Donna Faye McHaney, thank you so much for being a guest on today's episode of West Fair Video Conversations.
Thank you so much for having me.
And folks, we'll see you again next week. Have yourselves
Mhm.
a blessed day.